Today, I just had a conversation with a patient about their bone density and their DEXA scan. And I love that my patient was able to pull up their my chart and show me their DEXA scan and their vitamin D levels. And we got to have a conversation that was kind of unique. So if you don't know, your bone density is a very big deal, and you measure that with a DEXA scan, and you can get one every 2 years. I always want to know what my ladies' levels are at because I don't want you to have osteoporosis. And if you're in the osteopenia level, what we do matters because we can save your bone by changing your activity levels, making sure you have enough D3 with K2. I'm sure you have enough calcium because most of the time people do. And are you absorbing your vitamin D? But there was a twist with this one. My lady does HRT, and she's been on the lowest dose estrogen patch for a very, very long time. And she's also had widespread joint pain. And I talked to her about talking to her primary care doc about maybe it's time we move up the dose of your HRT, your estrogen patch, because we know that HRT is very important for helping us fight osteoporosis. So maybe we don't have to take prolia sometime. Maybe we can try to up your estrogen dose. Let's have that conversation because she is perfect with her activity levels, great muscle bulk, great muscle tone, walks 4 miles a day, works out, does all this stuff. There's really no reason why she should have this level of bone density issue. So what we do is have the conversation and find a vitamin D that works for her that is actually absorbed. So we test, don't guess when it comes to vitamin D. And so let's test. She knows that her vitamin D is in the 40s. And so now when she checks again in 6 months, we're gonna hope it goes up because if it's not going up, the supplement that she would be using isn't working. So she's been using a vitamin D supplement for a while and clearly it's not working for her. So I recommended to her what I am personally using and told her, hey, this is a very high amount. You can talk to your doctor. But if you're getting your D3, your serum D checked, it's going to be okay. We don't have to worry about that toxicity when you're in the toilet low. You might not be processing, but have that conversation with your doctor about your hormones and your vitamin D because it is not acceptable to have osteoporosis if you don't have to. We can prevent osteoporosis because 50% of women will experience an osteoporotic fracture in their lifetime. You are more likely to have been offed by osteoporosis and heart disease than breast cancer. So most women don't know that osteoporosis is a very big deal. And this woman is full of vigor and is buff and is awesome. And there is no reason for that bone density issue. So she gets to go back and have a conversation with her doctor. And I too get to have a conversation with the doctor, but it's a very lovely doctor and it's a lovely conversation.